Welcome to Hope Natural Health, the podcast inspiring you to be your best version. Join me, your host, Dr. Erin, naturopathic doctor, dog mom, cancer survivor, and girl boss weekly as we discuss all things health, hormones, and happiness with a little side of this thing called life. Welcome back to the Hope Natural Health podcast, where I try to get you healthy the right way. Last week, we talked all about our sex hormones, and this week, I have a very special guest. I have Dr. Chloe Williams with me. She is a dentist, and this is going to be such a valuable episode. I cannot wait to share it with you. So welcome, Dr. Williams.
Hi. Yes, thank you so much, Dr. Ellis, for having me on your podcast. I'm excited to have the opportunity to help educate your listeners from a dental perspective.
Yes, and dental health is so important, and this podcast won't air until March. I think we're about March now, but it's ironic because I just went to the dentist this morning, and I was laying there getting my teeth cleaned. I'm like, oh, and I'm interviewing a dentist later today, so it was super exciting and kind of ironic that I went to the dentist this morning, and here we are. And I know before we started recording, I was telling you how I love going to the dentist. So hopefully after the things that we discussed today and the education you provide, that other people will be like, all right, I need to go to the dentist, even though I really think that the main thing with the dentist is we actually have to force ourselves to lay there and do nothing for like an hour. And yes, most of us don't like to do that. And I think that's why a lot of people dread the dentist. Or a lot of my patients, if I ask them, like, why haven't you been to the dentist in a few years? And maybe they've had like a traumatic experience in the past and they just like really don't want to go. So everyone has their own reasons, but hopefully after this, people will like to go to the dentist. So tell me a little bit about your background and how you got into dentistry.
Yes, absolutely. So a little bit into my background, I actually grew up in a super health conscientious environment with both of my parents being very passionate about health and wellness. For example, as kids, we actually had to count out our serving size for our snacks and read the nutrition labels, understand that, the ingredients in our food. And when we were being punished, instead of being grounded like your typical teenager, we actually had to run wind sprints or do push-ups or pull-ups.
Oh my gosh.
Yeah, we had a pull-up bar in the hallway in our house growing up. So that was one form of punishment, was exercise.
Oh wow. Well, start you off young, right? Even though
exactly.
Exercise shouldn't be a punishment, but you learned about exercise at a young age.
Yeah, and as you know, exercise releases endorphins. So in a way, you're angry as a teenager, you're kind of angry about the world. And then you find out, exercise actually makes you feel better and releases those happy endorphins. So it was all good in the long run.
Oh, awesome.
So originally my plan was actually to follow in my mother's footsteps going into my career as an exercise physiologist. Until one day I shadowed a family friend of ours that was my pediatric dentist growing up, and just landed in something that would mold my passion for being able to still help others to live a healthy lifestyle through their oral health, but also be able to confidently smile about those accomplishments at the end of the day. So I began my journey into dental school, and about 5 years ago, I graduated from the University of Louisville, and my husband and I moved out to sunny Scottsdale, Arizona, where we can live in a climate of a beautiful climate where we can hike every day and just live a healthy life.
That's awesome. And your husband's also in the medical field too, correct?
He is, yes.
Nice. And where's your dental office?
We're in North Scottsdale.
Okay.
At the corner of Shea and Scottsdale Road.
Oh, perfect. Awesome. So yes, anyone in Arizona that needs a dentist, highly recommend. And the name of your dental practice is?
Yes, it's Douglas Family Dentistry.
Right. Douglas Family Dentistry. We'll have everything linked in the show notes too. So awesome. Well, you guys are more on like the conservative side of dentistry. So can you talk a little bit about exactly what that is?
Yeah, so great question. Conservative dentistry is really simply minimizing how much healthy tooth structure you're removing. Just like in medicine and dentistry, there are many approaches that you can take on how to treat dental issues. You may have experienced going into a new dentist and them telling you that you need a bunch of fillings and a bunch of crowns, and maybe you haven't had cavities and fillings in many, many years. So sometimes you might find that 3 of the fillings might need to be done, but maybe the other 2 are incipient, meaning they're small enough that they have not progressed deep enough into the tooth structure that they have to be drilled and filled. Oftentimes, if we pick up our oral hygiene techniques, we have the ability to remineralize or rebuild tooth structure. At the end of the day, once tooth structure is removed, you can't get it back. So you just want to make sure the structure is indeed irreversibly compromised and that there's nothing we can do from a natural standpoint to revert it back, or a more conservative treatment option that helps to maintain a little bit more healthy tooth structure.
What would be a conservative treatment option?
Yeah, so oftentimes, instead of doing a crown, which is a full coverage restoration, sometimes you might be able to get away with doing an onlay, which is more of a partial coverage situation. And that's just something that you can discuss with your dentist about what are all of my options. If I wanted to do a more conservative option, what would that treatment plan look like?
And I know you mentioned that if you kept up good oral hygiene, you could probably avoid some of these things. So why is good oral hygiene so important, and what does that really look like?
Yeah, so good oral hygiene. I'll start with toothbrushing. I really love, my favorite type of toothbrush is the Sonicare. I do think the electric toothbrush does a much better job at removing plaque from the tooth structure. I know personally when I travel, sometimes I'll bring my manual toothbrush and I can still feel that gritty feeling that accumulates on your teeth after you have something sugary. So I'll brush more.
Yeah.
So I am a big advocate of the electric toothbrush. I do really like the Sonicare. And then the other thing is making sure you're keeping up with flossing, everyone's least favorite thing to do.
Because it's so tedious.
It is, I know. And after a long day, the last thing you want to do is spend an extra 2 minutes flossing in the bathroom. I actually have my husband just keep a package of the floss picks in his car.
Yeah.
And so for him, it's convenience of flossing while he's on the road in traffic. So you can keep floss picks if that gets you flossing. And then
go ahead.
Oh yeah, go ahead.
No, I was going to say that I always thought that you had to floss at the end of the day, and you can really floss at any time of day. Is that correct? It doesn't have to be right before bed.
Yes, true. Ideally, if you want to floss throughout the day, that's great, but I would still floss right before you go to bed, after your last meal or your last beverage or anything other than water, just because in the night is a good time for all of that. If all of that sugar is removed before we go to sleep at night, we're creating a nice neutral environment while we're sleeping for our tooth to kind of reboot and remineralize throughout the night. So I like to, if we could pick one time to brush and floss, is right before you go to bed.
True. I know. I'm just saying, sometimes, like you said, it's like, after a long day, that 2 minutes, but it really doesn't even, I don't even think it takes 2 minutes. But it's just the act of doing it. But once you get into a routine, and I'm notorious for it, but I have to admit, and I told the hygienist this morning, I said, I actually have done the best I've ever done in my entire life of flossing between this appointment and my last one. And she could tell because my gums were they were inflamed. And then she was able, which was interesting because she said, now that you floss more consistently, your gums aren't as inflamed. And so she was able to find some hidden plaque or plaque that was like, slightly underneath the gum line that she couldn't find before. And I'm like, so there's so many more benefits to flossing than we think. So, of course, after hearing that, I'm like, all right, I'll keep up with the good work then.
Yes, I love it. Yes, it does. I mean, she's so right. The inflammation. And then if we have inflammation in our mouth, that can cause downstream effects that our body is having to focus on our oral cavity instead of other areas that it might need to be focusing on.
Right. Well, that kind of leads us into, a little bit of discussion about the oral cavity and why is specifically, like we have different pHs or acidity, I guess you want to say, in our body, but why is the pH of our oral cavity so important and how do we maintain a good pH? Can you talk about that?
Yeah, good question. So, cavity progression actually starts at a pH of 5.5. So, if we're constantly drinking, especially soda has a
Mm.
very elevated pH. So, if we're drinking lots of soda or we're consuming a lot of sugar throughout the day and we're keeping this acidic environment in our mouth, then we're more likely to develop cavities because cavity development needs an acidic environment for that to form.
Mm.
So we need that downtime in between meals because as soon as we put anything to our lips to consume, other than water, the acidic process and digestive process begins. So if we're constantly, I had a patient recently that was sucking on candy throughout the day because we were noticing all of these new cavities developing throughout the mouth. And we were asking what changed. And
Mm-hmm.
recently he had been sucking on sugar candy, hard candy, all day long. So his mouth wasn't having an opportunity to remineralize and become more neutral
Mm-hmm.
in between meals because of the constant sugar environment.
Mm.
Another thing we can do is after meals. So, of course, I work in a dental office, so there's lots of toothbrushes and floss laying around. But
Mm-hmm.
if you're drinking your morning coffee, which oftentimes has creamer in it,
Mm-hmm.
which has more sugar, we get in, and if we don't have access to toothbrush or floss laying around, then if we can at least swish with water and help bring our pH back to neutral, kind of expedite that process, and then have that remineralize period or break in between meals, then that's going to really help decrease cavity formation.
Oh, I didn't know that. Same thing as back to the whole flossing at bedtime. Like, get rid of all of the sugar from whatever it is. And it's not in, I think, a misnomer or myth that we've been told. It's like, well, I don't eat candy or I don't drink soda. Well, sugar is,
Yeah,
in food too. So it's not just the
right.
sweets and everything that we kind of labelize as sugar. It's probably you have sugar in your dinner. There's sugar in the sauce
Hmm.
that you maybe put on your salad dressing or ketchup on your
Yep.
fries. Like, there's sugar in everything. So it's not
Yes.
just the candies and the sweets and the creamer and all of that. It's, in regular foods that we're eating too. So very, very, very important. How do you recommend maintaining like a good, healthy oral bacteria? Because, and this might lead into, a little conversation about how if you have unhealthy bacteria, how that can lead to possible disease processes in the body because it really starts in the mouth.
Yeah, it does. It does. Definitely. Yeah. So as you know, there's always tons of bacteria all over on our skin, in our gut, in our mouth, both good and bad bacteria. So what we want to try and do is modulate or equilibrate our oral microbiome towards healthy bacteria. And we can do that through, like we talked about, physical removal, just
Mm-hmm.
or simply brushing, flossing, mouth rinsing. There's a new mouth rinse on the market that Biocidin, I don't know if you're familiar
Oh,
with that
yeah.
product.
Yep.
Yeah, that Biocidin came out with that's called Dental Cidin, and it's a mouth rinse
Oh.
that is that oral microbiome modulator. So it's a nice natural
Huh.
remedy to encourage good bacteria in our mouth, similar to the biocidin that does this for us in our gut.
Yeah.
So I love that mouth rinse on the market. That's probably one of the newest ones that I've heard about that I
Hmm.
really like. And then intermittent fasting is a great way too to reset the microbiome in the oral cavity and in the gut.
Yeah. How is and I'm assuming, but can you confirm the mechanism of that is that you just give your body that rest so it can neutralize, correct?
Yes.
Yeah.
Right. Exactly.
That's, oh, awesome. I didn't know about the biocidin. I love biocidin. If you're a patient of mine, you've probably heard me talk about biocidin. It literally can, I say like in quotes, like kill anything. It's a very powerful antimicrobial, bacterial, fungal.
Right.
It's awesome.
Right. Yeah. I love that they created a dental component, a dental side to that.
What are your thoughts on oral probiotics? There are a few chewables out there, like there's one called Fluoride. There's like Probiomune. It used to be, I think they relabeled it. But what are your thoughts on like chewable probiotics that are specifically for the mouth?
Yeah, so I know there's a lot of research going around right now with probiotics for the mouth. I don't know that they have a great one that I've personally read about yet. I know that's all in the works, and I mean, every day is changing, and medicine, and especially natural medicine, is evolving every day. So you may know more than I do regarding the oral probiotics. I'm just familiar with the modulator, that dental cidin at this point.
Okay, cool. I didn't know if you had any insight on that. And then this is just something random I'm going to throw out there that I mentioned to you before we started recording, but what are your thoughts on fluoride?
Yes. So it's funny because my husband is a PA in integrative health and very conscientious of any toxins that he puts in his body. And so he is very anti-fluoride. I can see both ways.
Yeah.
If you're very cavity prone, I mean, we see a lot of rampant decay, and so it's all a balance, weighing out pros and cons. If you seem to be more cavity prone, I think that fluoride has a place. Maybe more topical fluoride. Sometimes we'll apply a fluoride varnish to the tooth to help strengthen it in office. But as far as drinking it systemically, we have our fluoride removed from our water. We don't drink it systemically. But I think that as a topical agent, when necessary, it's just like the pharmaceutical world, right? Like, there's a place for it, but only when necessary, because it's not something that's good for our overall health. It's good for our teeth, but it's not good for our systemic system, which is why they keep it in such a low dose. But when necessary, sometimes the pros outweigh the cons for topical.
Can you explain for someone that's listening that might not even know, like, why is fluoride important for the tooth?
Oh, yes. So our tooth is a crystalline structure. Hydroxyapatite is the chemical compound that makes up our enamel. And when they found that when fluoride is mixed into the equation, it becomes another substance called fluoride hydroxyapatite crystalline structure. So the chemistry of the fluoride mixed in to the enamel tooth structure, it creates actually a stronger crystalline structure, and it's harder for cavities to penetrate through. So that's what fluoride does. But I know my husband, he will not touch fluoride, but he also doesn't eat sugar. He doesn't, he's very disciplined. So I think if you live a lifestyle that is very disciplined and you don't have a high cavity rate, then maybe you don't need that added protection.
Are there, you've said prone to cavities or high cavity rate a couple times. Besides high sugar in the diet, are there any other, I guess, contributing factors or like high risk factors that someone would have to have, that are more cavity prone?
I would say, because I know some patients say, oh, it's, genetics, my parents have a lot of cavities, and you'll hear that just in health in general, oftentimes. But I am a strong believer that a lot of that is connected to the habits that our parents had, And now we develop, because that's what we grew up with.
Right.
And so therefore it's a higher sugar load. We're maybe drinking soda because that's what we grew up with. Sweet tea. I'm from Tennessee. So in the South, they're drinking a lot of sweet tea. So I think a lot of that is more from diet that would make people more cavity prone, not so much genetics. However, I will say that there are some cavities that can develop due to the anatomy of the tooth structure, which would be genetic. Some people will have deeper kind of grooves and divots on their teeth.
Okay.
And that's why they came out with putting sealants on the tooth structure to kind of seal up those deep grooves. But if you didn't have sealants, then sometimes those grooves make it more susceptible to getting a cavity as well.
Yeah, I had sealants as a kid. But I never had cavities to put the sealants on. And honestly, I got my first cavity when I turned, I think, 31 years old. And I was traumatized and I cried. And I called my mom and I said, Mom, I have my first cavity. This is terrible.
Oh, well, and I always try. I know that especially that first cavity, I know it's kind of a traumatizing event. So I try to let patients know. I love how on your podcast you oftentimes talk about the root cause, because I really do like to go back to that in dentistry and find out, okay, what did cause, is there something that changed in your diet, or was it just because for you possibly it may have been that sealant, sealants don't last forever, and eventually they'll actually start to kind of break down, and eventually cavities can kind of get under the area that it breaks down. So it may not even be something that you did wrong. You might be doing everything right. So I like to let patients know that so they don't feel discouraged. Like, what? I'm brushing and I'm flossing. How did I get a cavity? And sometimes it's not the patient's fault. It's nothing they're doing. It's just the materials breaking down over time.
Yeah, I think that might have been, well, that was, I think, prior to, or it might have been right around my cancer diagnosis, before I really learned about, or taught myself that, soda wasn't very good for me, and maybe I should eat more vegetables and clean up my diet a little bit more. So I don't think I was the healthiest. So I think it just caught up with me, and I'm surprised that I'm not surprised, but because of those sealants, I probably would have had a lot more if I didn't have them. So
yeah,
I don't even know how long they were there, but I do remember the dentist saying that, yeah, they're not going to last forever and they're going to break down. But I think I may have had one other one since then, like very, very minimal. So I'll keep it that way.
Yeah.
Awesome. Do you have any other tidbits of like good oral, I guess, whatever that you would like to share with the audience?
I would say my ending tip is, as Americans, we consume far too much sugar, as we mentioned, in the American diet. Like, I love that you were bringing out the point that patients do. I had a patient that said we were finding all these cavities, and he was eating Ritz crackers. And so he's like, but that doesn't have any sugar, right? And he was waking up in the night having a midnight snack of Ritz crackers. So then he switched. He said, well, the next time he came in, I switched to vanilla wafers. Is this better? And I, because it's not candy. I mean, I love that you brought that to the attention, that it's not always candy that is sugar. It can be so much of our food. In the American diet.
Like I'm drinking a green juice right now. It's loaded with sugar. And it's green. It's greens and fruit.
Right.
It still has sugar in it. It's got an apple and it's got lemon. There's sugar in everything.
Yeah. Yeah. So I would say my lasting tip is just to challenge the audience to become more aware of, look at the back of the label. Is sugar the first ingredient? Because they're in order of how much of that component is in your drink, your food, and then look at how much sugar, and then count up, how many grams of sugar am I eating in my whole day? I think we all splurge, maybe except for my husband. We all have splurge moments, but just trying to limit the frequency and duration of our sugar intake.
Yeah, it's so true. And that's the first step, is to become aware of how much we're consuming of anything. And that's what I tell patients too. It's like, don't cut it out. Just be mindful.
Yeah.
Like, pay attention to what you're eating, and it might blow your mind if you're having sugar at every meal. And then I guess if you do splurge, just remember to brush and floss right after, right?
Yep. You're absolutely right. Yep.
That way you can help your little teeth out and your pH and your oral bacteria and all of it.
Yes, no harm, no foul at the end. Yeah.
Right? Oh, Dr. Williams, this is so awesome to have you on. I love talking about teeth. Teeth are so important, and we must take care of them. And I really appreciate Kelly is one of your Kelly Jessup's one of your hygienists, correct?
Yes. She's our dental assistant. Yes.
Yes. Well, she connected. She's a dear friend of mine, and I really appreciate her connecting both of us. And I am excited that you were here and to share your knowledge about oral health, even though it sounds boring to some people, but it's so important. And everyone, go out there and get yourself a good toothbrush, some floss, and if you don't want to floss, get the little dental picks. And if you haven't had your teeth cleaned in a year, we'll say a year, even though you should go every 6 months, go find Dr. Williams at Douglas Family Dentistry, and all of her information will be in the show notes. Thank you so much for being here, Dr. Williams.
Love it. Thank you so much, Dr. Ellis.
You're welcome. We'll see you all next week.